2022. I welcome you all again. I really want to thank you for your work, for your patience, for your commitment to this vision. So I know before the care plan, all these, we've had a care need assessment. So this is the third phase of the total care project. The first phase was about the screening and all the plan, preparation for the project. Then the second phase was the care need assessment, which was completed duration of 1 month, thereabouts. And then the third phase is the care plan meeting. So what is the care plan about? So care planning is defined as the process of developing an agreement between the client and the healthcare worker regarding the problems identified, the outcomes to be achieved, and services to be pursued in support of goal achievement. So listening to all of you, there are problems that be identified during the care need assessment. So the care plan had to be done, together with the clients. So we're using clients now because they're not patients. They are not like inpatients in the hospital. So we're not going to be calling them patient. So they are clients. All this elderly that has been assessed are clients. So we're going to develop the care plan with them, not just for them. So the reason why we're doing with them, we have already we have the information from them. So if you have a link up back to them, so you'll be able to do it regarding the problems that have been identified and what are the outcomes we want to achieve. So for instance, a patient that is diabetic, so what is the outcome we want to achieve? How long, what's the duration? What do you want to say within 6 months, the sugar level will be normal, things like that. What are the services you want to arrange for them to support the goal? So that's what the care plan is all about. So basically for the care plan, we are expected to use clinical judgments. As healthcare practitioners, I know there are different cadres of healthcare practitioners, and some are not even in the healthcare profession, because this is a general program that also embrace non-healthcare professionals. So, but in each cohort, we're happy that we have one registered nurse, in every cohort. So you'll be using clinical judgment, your clinical reason, the knowledge, clinical knowledge, all this should be used in, planning the care for each of these clients. And of course, your knowledge of, disease conditions, your knowledge of the pathophysiology, of the mode of action of medications, of treatment plan, all that is what is required as well in care planning. We will do a case scenario at the end of this. Now, creativity is also very important when it comes to care planning. You need to be creative about it. When you say creativity, there's no one-way ticket. There's no one-size-fits-all method. That cannot work in this, because individuals are different. As much as possible, we want to provide a person-centered care for this elderly. Person-centered, individualized care. So somebody has a high blood pressure of 200 over 100. Another woman also has high blood pressure of 220 over 100. It might not be the same mode of action, process. It might not be the same treatment regimen they have. People have different needs. Probably hypertension might not even be priority for her. It could be something else. Maybe there's something triggering the high blood pressure that needs to be looked after. So you have to be creative about this. We also need to look at what are the available resources around that we can utilize to support them. That's talking about creativity as well. Now, one of the things that were mentioned during the report was there's a particular cohort that in the location there's no healthcare center. All right, so can we be creative about this and see there's no healthcare center? So what can be done to reach out to this vulnerable elderly in that location? Rather than they going out other places, or maybe not even going because there's no, can we bring health to them? How can we bring health to them that would be very accessible, affordable, all those kind of things. So these are the thought line we need to have to be very creative about things. Then sensitivity. Now, this is very important. I've really what will I call it? I'm happy that I heard something. Is really something that really triggered something in me. Like we need to do something about it. It's about the language barrier. So we understand that Nigeria is multilingual, of course. I think this is one thing to know, and anyone the program directors to know this. We have to uh, encourage our volunteers to be what will I call it now? Have language diversity. You know, personally myself, I'm a medical translator trainee, you know, with WOP organization, trying to encourage healthcare professionals to be multilingual as much as possible so that we can meet the communication need of our clients at any point in time, rather than waiting a long days, long time for translator, or you know, that could cause delay in care. So that's something I think Respo Health will also be thinking in. We'll look for how we can develop courses. We have Hausa, Igbo, so that all our volunteers will have basic knowledge, some basic communication knowledge about, you know, different languages. So that's something that is it's coming out of our assessment. So thank you for that. So sensitivity to cultures. Yeah, you're going to assess or to plan a care for somebody. You need to be sensitive to their culture, to their belief, and not just like somebody mentioned. One of them said she doesn't believe in medical treatment. It does not work. It's not real. Yes, we know those are misconceptions, but you will not just say that's not true. So there's a way you can be sensitive to their belief at the same time, also educating or introducing your our own point of view. You understand? So it's being culturally sensitive, um, as well, protecting yourself as volunteers. If you're going out, you need to be sensitive to your safety, safety of others. You know, look around, and if an environment is not safe for you, you need to be very sensitive about that. So all or some of all these there might be some other issues like family dynamics as well that you need to be sensitive. Over here we've had families that some members of the family will say, I want my mom in a nursing home, and then I will say, no, I don't, I want my mom home, I want my mom in the hospital. So just look at what's this dynamics, what's going on in the family, what's going on with this particular situation. This will help you in your care planning. All right, so now remember when I was defining care planning, we talk about problem identification. So from the care need assessment, you need to go back to each of the form per individual. So what is the cause of the problem? Can the cause and therefore all of the problems stemming from it be eliminated? So is this something that can be eliminated, this problem that you have identified? Can the cause be modified to alleviate some of the attendant problems? So if we identify a cause, for instance, like somebody mentioned about diet, somebody that is diabetic, okay, without taking medication, what do you think is the cause of the diabetes? Generally, you think of, oh, the diet is too much carbohydrates. Okay, can the cause of the problem be eliminated? You can't take away their cassava from them, or their pounded yam or yam from them. You can't take it away because that's what they eat. Now, can the cause be modified to alleviate some of the problems, you know, if not all? So now you can talk about education, about, you know, diet and all that, like you have mentioned, creating awareness, helping them to see how they can modify their diets and things like that. Or is the cause unalterable? That means something that you can't touch, so that all problem resulting from it requires specific intervention. Now, the cause, you may not be able to remove the cause in some cases, like even still talking about uh, diabetes, you know, you might not be able to do anything about it now. So can we just focus on the treatment to make sure that maybe they're taking their medication, they're getting all their blood pressure, their blood sugar checked, and to monitor in such a way? So that's talking about problem identification. What are the common causes of the client problem? So from literatures, there are common causes of problems, especially for the elderly, and they're classified into physical, psychological, and so on. So let's take one after the other. The physical one could be due to fatigue or weakness, hearing impairment, incontinence, where maybe I don't think anyone have been mentioned that another elderly is incontinent. Mobility impairment. I remembered one was mentioned about not being able to walk or having bad legs, wound in the legs, paralysis, pain or pain, poor nutrition, speech impairment, untreated health conditions, visions, and so on. So what are those? Psychosocial could be as anyone has alcohol abuse, confusion, or unsafe judgment, any difficult family relationship, any drug abuse that had been identified, emotional or behavioral problems, physical abuse, neglect, financial abuse, whatever abuse, sexual abuse, any problem person in the household, that from your assessment. Environmental, that's why we really emphasize that we should do home assessment, So any architectural barriers in the building that is causing fall, or maybe the house is not habitable. I've seen the videos from some part of the Lagos and some other cohorts that even where they live is not habitable at all. Inadequate income, inadequate level of care at home, unsafe home or neighborhood, and so on. So those are the three categories. They're not limited, but you can explore them. Now, we know that the assessment guideline that has been followed, there are about 1 to 20. So the care plan process actually begins during the assessment. So like some of you have already talked about, as you're assessing them, you are already starting the planning. So the identification of the functional problems and their causes, then discussion on assessment guidelines. There's a document I would send to the group that has these guidelines 1 to 20, okay? So now let's talk about the options for care planning. For each problem, the care plan should include the problem type, outcome standard, common types of help needed, and the service provider options. So if you had 19 elderly that you assessed, so each of them has to have these care plan templates. So I'm going to show you a table. What's the problem type? What's the outcome standard? What's the common types of help that will be needed for this person, for this problem? And what service provider do they need? So you need to state the problem and the outcome standard, like I said, or the desired outcome that you want to achieve, the common types of help needed, the service provider options. So these are kind of templates. I'm kind of rushing because of our time. And there's another document I'll send as well. So options for care planning. Example is hearing problem. So for instance, a client that has hearing problem, that's the problem type, okay? Outcome standard or the desired outcome is that the client will have maximum hearing. That's what we want to achieve. This client has hearing problem, but we want to make sure to achieve that the client has maximum hearing, okay? And or the client is safe, because sometimes if you can't hear well, you won't be able to, understand or recognize danger around you. So how do we ensure that the client has maximum hearing and or, okay, if you cannot get maximum hearing and the client, and we just maintain that the client is safe. So what are the types of help that will be needed for this to achieve this outcome? One of it might be medical evaluation. So the patient needs to be examined medically, audiologic evaluation, maybe hearing aid, might need the hearing aid, maybe the hearing aid needs to be repaired or needs to be provided, special equipment needs to be monitoring, continuous monitoring, and maybe you need to modify the environment of the patient so that the patient will be able to, maneuver in the environment safely. Now, service provider options. So I've divided this into two, informal and maybe you're using an agency. Informal are usually family, friends. So you can see that the medical aspects, the family and friends cannot help basically, but they can help for monitoring and to modify the environment or to support the patient with special equipment and all that. But the patient will need a medical assessment by a specialist, an audiologist, we need a hearing aid company or to purchase one, So these are just examples. So look at, for a particular problem, what are the informal providers, service providers that the patient needs? And then agencies, when I say agencies, I mean organizations or health institutions or, healthcare facilities or so does this patient need? Now, let me use a typical example from the ones that we have mentioned. I will talk about the person that I'm trying to remember, that the person that has wound, it has a big wound in the leg and so on. So that's the problem. What do you want to achieve? Wound healing for this patient, and the patient will be able to mobilize well and so without another outcome. So you can have more than one outcome, another outcome that the patient will not develop, sepsis or infection, will not get into the wound or so. Now, the common types of help needed, of course, will the patient need the wound to be assessed, maybe some scan to be done to see what's the extent of the damage, and all that. We definitely need hospital admission for wound management and, finding out any underlying issues that surround the wound. Medication will come in there. If there is a wound specialist, we need to see if it's over here. We have what they call the tissue viability nurse that will assess the wound and see what kind of treatment is suitable for the wound. So wound dressing, how many times daily, than your movie, well, every other day, what kind of dressing equipment will the patient need? All those kind of things. So those are the common types of who will be providing this. So if there's a financial aspect of the family and friends that will be supplying this equipment or, bringing the patient to the facility so that the patient can get the necessary care. So that's a kind of, it's just to use that as an example. All right, so after you have drawn that for each of your clients, now the next is the service arrangement. So to implement the care plan, service arrangement means through both formal and informal providers, like we have mentioned. So the role of the volunteers here does not end just like that, also continues into, getting them both formal and informal providers, serving as that link person, as that advocacy, like that advocate, So the case managers, in this case, volunteers, had to be knowledgeable about the service availability in their respective communities. So I've mentioned this right from the beginning, that you need to be, knowledgeable, have an understanding of what are the services that are available around this, in this community or, in the nearest community that should be suitable or appropriate for your clients. So these steps, I know sometimes required extensive communication with the client, with the family, with the providers. And I understand that we are all very busy with other things, but with the time frame that we have, we should be able to cover, to reach out. So somebody needs, like one of the cohorts I mentioned, a patient that was hypertensive and needed, because if a patient has persistent high blood pressure without being checked, it's a very, very, it's a risk factor for stroke, And before you know it, most of the data, you just say, oh, the patient just fell and died, or that person just collapsed and had stroke. Just like that, stroke does not happen in a day. So it's an, accumulated or untreated. And one of the major causes of stroke is hypertension, or maybe immediate, so very, very, what will I call it now? Prompt surge or increase or overtime build up, blood clots, so many things like that. So this needs to be addressed. So you look around, this patient, is there any hospital? I remember I mentioned that, is there anything? And also there's no health center, there's nowhere around. Okay, where is the nearest facility? Can we arrange that this patient goes to the hospital and get the blood pressure monitored and get the proper treatment? Now, this is the point. This type, like I said, it might require time, require more, your commitment and seeing you being able to be selfless. So that's what volunteering is all about, okay? Scheduling time and all that. So that's the service arrangement. Now, apart from this is the monitoring. So to assure that the services provided as specified in the care plan, you need to monitor the patient. It could be very challenging because you're not living with them. And there could be other initiatives that could come from all the volunteers. How can we ensure monitoring? How can we, have that baseline of that progress track for our clients? So I'm hoping to hear feedback from you about this. So maintaining contact by telephone, in person, with the provider, with the client. So if you are linked up any clients with the provider, you not just link up and forget. You must continue to monitor and get feedback, from the provider, from the clients and their family member. So reassessment, of course, maybe there is need for you to readjust the care plan to any changing need. This can be conducted, and I think we said this can be 3 monthly after the program entry. Maybe you go again after 5 to 6 months and reassess like that. So this is a 6 month, and this is the 3rd month. Open that, okay, if you are able to do the care plan, say we can reassess again after 3 months. So this reassessment was the basis for continuing, revising, and discontinuing service. So at the point where, oh, this person is fine now, okay, after reassessment, there's no need for any continuous follow-up, and then the patient can be discharged from care. All right, so that is about that. So I need us to look at, these are the expanded service coverage that might be on request. So 19 different service categories will be made available, or will be made available, or may be made available as required. So this, I put this just for you to see the array of services that we can arrange for the clients. Okay, I say array because they're numerous, so you don't run out of options. Some of this might not be applicable to our locations, but I always look like what are the things that we can adopt from the developed country, and so that can work in our locations. Do we have day health and rehabilitative care? I'm happy to some of the things. This is one of the plan of Respo Health to have. This is a long-term vision that we hope will come to pass, to have a day health center in each of these locations that we have started with, from our pilot, a day health center for the elderly, where they could come in, like you were talking about, getting their medication and things like that. They will have a doctor, they will have a nurse, like a day, just like a day, like you have younger people go to daycare. So this is like a daycare for the elderly. So we are hoping to have this in the nearest future. Rehabilitative care, they can also get rehabilitative, maybe they need physio, they need wound care, a maintenance care. Now, other thing that we can look out for is home health aid. Yeah, one of the coordinator there mentioned about she arranging for some younger people to fetch water for some elderly. that is a home health aid that you have provided. And I really want to thank you for that initiative. Now, why this could be unpaid, it can also be paid. If this, for instance, if you have a family, if that elderly has a strong family support, we can make arrangement for a home health aid. And just for you to know, Respo Health has a training plan for a professional home health aid. So these are some of the things that will be rolling out as we do this, as we go on with our projects. So for instance, if you realize that in your location, an elderly might need a home health aid, we don't want to use what they call omodo, okay, because we do not encourage slavery. And so, but we can train people to be professional home health aid, train them, they pay a token to do this, or they volunteer to do this. You understand? So we can have volunteer home health aid, we can have, and they get, what they get is proper training for this, and they volunteer with Respo Health. After some time, they can become an employee and work in that regard. So I want each of the coordinators to see this, that you are building up your location, you are building up your team to be an expanded service coverage, either by developing new, by establishing new service, or linking up with existing service. So see yourself as not just a volunteer, but a CEO in that location, manning your elderly. So if you had 10, you had 19 elderly, I need you to see them as a caseload under you, that you need to build, have a plan for their care, so that's what I just want to pick. So like home delivery meals, over here we have what they call meals on wheels, for patients that are wheelchair bound, and so they cannot go out looking for food themselves, so their food are delivered to them in their home, all those kind of things. It's not like some of them are free, because almost healthcare, everything is free over here. But in Nigeria, for instance, we need to look at what's work. All right, can we make some advocacy call to provide meals for some elderly that do not now, because people could take advantage of situations that cannot afford healthy meal. Maybe you want to include that in your plan. It could be part of your care plan. So do they need respite care? Now we know most of the African countries do not buy the idea of nursing home or respite care. So respite care is just a place where they could go briefly, maybe 2 weeks, and that as well is one of the vision of Respo Health. So we have a daycare center, respite health, respite care, where they could go. Maybe a patient has been admitted to the hospital, treated, and need to go back home, but still needs some rehab, still needs some support before going home. So respite care will be maybe a 1 week respite, 2 week respite before going back home. Or maybe the house needs to be modified and get the necessary support before the patient can go home. So that's what respite health care is all about. Does the patient need skilled nursing? Now, Respo Health, we've employed some nurses to be home care nurse to some of our clients. Like we have 2 in Ondo, we have another one in Abuja, and another one in Oyo State. So we are, based on the client's need and request, so we can provide skilled nurses. So if you are a nurse here, that could be an opportunity for you. If you have, that's another thing you have to do. If you have that kind of client that is looking for a skilled nurse. So physical therapy, you may need to link up with the physiotherapy and all that. So look at this, I won't go through all that. Another one that could come up is mental health services. During your assessment, do you think these clients need mental health check and all that? A simple one also could be transportation, house chores, housekeeping. I've talked about that's one of the things about the home health aid. Routine consumables. Do they need somebody to help them get stops and all that? Equipment. Does this older person need walking stick? How can we get him a walking stick and not just a stick that they want to cut from a tree, that could also pose danger? So getting them the right equipment, adaptive or assistive equipment and all that. So the reason why I'm sharing this is that so that when you're thinking of the plan of care for the action, you have diversity. You can, you have a very wide array of service that we might think of. All right. So that is all about the care plan. And again, this is total care package for the elderly for the 2022 from Respo Health Africa. And our vision is to continue to promote responsive health care for the elderly. We have started with 100 elderly, and we hope that we'll be able to give them comprehensive health assessments, link them up or provide adequate care interventions for them, as well as care advocacy. Now, before I'm going to entertain questions now or contributions, I just need us to understand that, because I know there was a request that people wanted more and they're looking out for more. As much as possible, what we are doing, this phase that we are in, is a project. It's not more of a service delivery. So let's see it more as a care project rather than a care delivery. Now, as part of this project, we will be care that will be delivering will be in conjunction with available services. So we are going to be linking them up with available services, and where there are no services, then that will be part of our plan of action, which might not be an immediate action to establish those services. If you understand what I mean? So, we are an upcoming or a fresh start organization, and we really want to have a solid background, which is the essence of this project. Thank you so much again for listening. Thank you for your time. If you have any question, you can share with us. And if you want to support us, please, we are looking out for support. This is one of the things that all volunteers need to be doing as well. And I've seen a few, and I really would need to appreciate a few that has gone up to the social media to promote Respo Health, to talk about what they are doing with Respo Health, because you might not really, like I said, you don't know the value. You don't know the value you are bringing in. You don't know how much valuable you are, but you are valuable, and what you do, it's not unrecognizable. So if you have not been doing that, you want to take it up as well. Talk to people about Respo Health. Use your social media network, even your WhatsApp. If you are not on LinkedIn or all these other places, your WhatsApp status should be speaking about Respo Health. So your volunteering is not just to the elderly, but also doing it as well to promote the vision of the organization. So let's continue to do that. And adventure, you're watching this or you're listening to this, that this is Respo Healthcare, and we're looking for sponsors. We are looking for partners. We are looking for donors. So donate to this cause to help an elderly, get a responsive healthcare. Thank you so much again. My name is Olayinka.
Wow, thank you very much, Nurse Koshora.
Thank you.
So I think we are done.
Yes, thank you. It's late already. I'm going to let us go. If you have any question whatsoever regarding the next plan of action, so please go back to your cohorts now. The cohort coordinator, this is your role. You might bring in other members of your cohorts if they're available to work with you, or distribute each of your distance to each volunteer that are available if possible, or this is your responsibility to have that care plan. I just need it in that template, okay? I'll send a copy to you so you see as well in that template so that we can move ahead. Thank you very much. Have a lovely night and happy Sunday tomorrow. Have a lovely week ahead as well. So can we give a time frame for the care plan? The care plan is more months as well. So which I started a week ago. So we have 2 to 3 weeks to finish up the care planning. Alongside the care planning, if you have to do some interventions like lift up, that's part of the service agreement, please do that. Thank you. All right. Good night, everyone. Thank you so much for the attendance. Thank you for coming. God bless you.